signed in recent history. The operationalization of TEN and Sankofa will bring Ghana's gas production to above 300 million standard cubic feet a day. Mr. Speaker, as part of our commitment to fully incorporate renewable energy into our supply mix, a number of solar, wind, tidal wave, and biomass projects are being pursued. The African Plantations Limited project, under which thousands of hectares of eucalyptus trees are being planted as fuel wood, would eventually generate 120 megawatts of biomass power. It will also provide employment opportunities for our farmers and technicians in the operational area. We will be rolling out this year new initiatives on solar energy. A prepaid solar meter scheme that would enable residents of remote off-grid communities to own and enjoy solar lighting will be launched as a private sector activity facilitated by government. We're also working on a proposal that would make solar power available for micro-enterprises operated by barbers, hairdressers, dressmakers, and other such micro-entrepreneurs whose businesses are currently affected by the present power challenges. This solution will also be available for residential consumers who desire it. We estimate that in installing 200,000 rooftop solar systems, we will save this country about 200 megawatts of power daily. It is proposed to fund this initiative with an adjustment of the Energy Fund levy on petroleum products from 0.05 pesos to 1 Ghana peso, part of which will be used to establish the Renewable Energy Fund. We also propose to introduce an ancillary service charge of 1 Ghana peso per kilowatt hour of electricity transmitted, part of which will be used to support this solar photovoltaic system. Mr. Speaker, while we work on the generation side, we must also look at the issue of power conservation. By following the simple tips published by the Energy Commission and the PURC, we can lower our electricity bills significantly. I wish to commend the Energy Commission for the successful start of the refrigerator energy efficiency project, under which the Commission is replacing old refrigerators with new energy efficient ones for households at a discount. In Ghana, on average, refrigerators consume more than 1,200 kilowatt hours of energy a year. If you consider that almost 30% of households in Ghana have a minimum of 2 refrigerators, then a lot of energy can be saved. We've also started the conversion of CFL bulbs to LED. In many areas, solar-powered LED street lights have been installed. This has the potential to reduce the consumption of power by lighted bulbs by up to 60%. In addition, it is reported the LED bulbs last longer, in some cases as much as 15 years. Mr. Speaker, the agenda to transform the structure of the economy and position it as an export-driven rather than an import-dependent economy is on course. United as one people and with determined commitment to its attainment, we shall transform the structure of this economy. As President, I'm required by the provisions of Article 36, Clause 5 of our Constitution to present to Parliament a coordinated program of economic and social development policies, including agricultural and industrial programs at all levels and in all regions of Ghana within 2 years of assuming office. I have accordingly submitted to the 6th Parliament of the 4th Republic of Ghana the Coordinated Program of Economic and Social Development Policies 2014 to 2020, an agenda for transformation. Mr. Speaker, this program forms the core of my vision to transform and covers a broad range of issues in the area of social and economic development, infrastructure, and institutional development. It also highlights a number of priority programs and initiatives that government will be pursuing in the short to medium term. I look forward, Mr. Speaker, to the debates of the program, which will feed into the preparation of a long-term national development plan by the National Development Planning Commission, NDPC. Mr. Speaker, education remains the surest path to victory over ignorance, poverty, and inequality. This is self-evident in the bold initiatives we continue to take to improve access, affordability, quality, and relevance at all levels. A decade and a half into the new millennium, we are providing through our basic education program equitable access to good quality, child-friendly, universal basic education. Through improvements in infrastructure and quality of teaching, provision of teaching and learning materials, management and supervision of schools, quality and access to basic education is being enhanced. To provide opportunities for those who are unsuccessful in their basic education certificate exam, we have for the first time introduced a resit policy at the basic education level. The policy was given true meaning when 1,181 candidates last week had the chance to resit their BECE as private candidates. These are persons who, but for this golden opportunity, would have otherwise had their education truncated at the JHS level. Mr. Speaker, the story of a 46-year-old prisoner, Alexander Dobare, and 4 other inmates who took part in the resit in Wa in the Upper West region reflects how golden and important the resit policy is. The story of Dobare is similar to that of many others, aged between 16 and 56, who took advantage of this unique opportunity to better their grades with the hope of furthering their education. As a nation, we must and we are creating the necessary opportunities for all children of school-going age to have access to quality education. We'll continue to deliver social intervention programs that will sustain access and reduce the cost of education to parents. This year, we'll start with the distribution of 10,000 locally produced made-in-Ghana school sandals to pupils in selected deprived districts. Mr. Speaker, we'll distribute 6 million textbooks this year. We'll distribute 500,000 pieces of school uniform. And Mr. Speaker, we will deliver 15 million exercise books to the children of Ghana. And in addition, 30,000 computers will be distributed to schools across the country. I am convinced that we have enough capacity locally to print this material in Ghana. I've asked the Minister of Education to ensure that domestic printing houses are fully involved in the printing of this huge educational material. Mr. Speaker, there are more children in school now than ever before. At the close of 2013-2014 academic year, over 5.4 million children were registered and enrolled at the basic education level. This compares to a total enrollment figure of 4.6 million in the 2008-2009 academic year. To consolidate our attainment of universal basic education, 24,117 out-of-school children were enrolled into school under the Complementary Basic Education Program, which we began in 2014. Through this, more of our rural poor were offered opportunities to be educated in 4 regions, in the Northern region, Upper East, Upper West, and the Brong-Ahafo region. 100,000 out-of-school children are being recruited this year to expand the program to cover the remaining 6 regions. Mr. Speaker, our focus on quality education requires the enhancement of teaching skills. To that end, about 160,000 teachers, representing 56% of our teacher population at the basic education level, received career development training. Another 1,000 teachers have also undergone in-service training in line with the objectives of improving the teaching of mathematics and science. We shall continue with our interventions to improve the teaching and learning of mathematics and science across the country. We envisage that this will help us meet the target of 60-40 in favor of the sciences as against humanities at the tertiary level. And this is in line with our national development objectives. Mr. Speaker, as this House is aware, gender parity at the basic level remains a major priority in our education policy. We've attained a 1-to-1 gender parity ratio. Over 92,000 girls have benefited from the take-home ration program in the Upper East, Upper West, and the Northern regions. And under the Global Partnership for Education program, 55,000 girls in junior high school will also receive scholarships, school uniforms, sandals, bags, and school stationery. I'm pleased to report, Mr. Speaker, that the school shift system through which pupils run shift due to the lack of adequate classrooms has now been eliminated in many of our districts. In Wa, Sunyani, Takwa, Dansoma, Accra, Krachi in Chumuru in the Volta region, and many other areas, school children can no longer skip school to play truant, hiding behind the excuse of the shift system. Mr. Speaker, enrollment at the second cycle level has also increased by about 10% between 2013 and 2014. This is the direct result of the general improvement in the teaching and learning and provision of critical infrastructure. More than 1,000 different projects ranging from dormitories, classrooms, dining halls, auditoriums, and administrations blocks have been executed in secondary schools across the country. In fulfillment of my vision to expand access to quality education, construction work is ongoing on the initial 73 community day senior high schools. And work will begin in 50 other locations this year. Mr. Speaker, we shall also commence the implementation of a number of interventions under the 156 million World Bank Secondary Education Improvement Program. The interventions include: 1, improving facilities and quality of education in 125 existing secondary schools. 2, providing 10,400 needy students with scholarships. Building the capacity of 6,500 mathematics, science, and ICT teachers. And 4, providing leadership training for heads of second cycle institutions. Mr. Speaker, the last phase of our Science Resource Center project, which will benefit 100 senior high schools, will commence this year. As I announced in my last State of the Nation address, government will begin the implementation of the progressively free senior education program at the start of the 2015-16 academic year this September. This will benefit an estimated 367,000 day students. They will pay no fees. As you are aware, Mr. Speaker, honorable members of this House have approved adequate financing for this program in the 2015 budget. And I thank you, honorable members, for that. Mr. Speaker, my resolve to expand access, improve quality, and to ensure affordability was accentuated when we analyzed the results of the West African Secondary School Certificate exam over the years. Between 2006, when the West African School Certificate exam began, and 2014, the best performance index on students who attained grade A1 to C6 was in the year 2012. Incidentally, the worst performance was recorded in 2007. Mr. Speaker, in 2012, the statistics are, Mr. Speaker, in 2012, 31.119% of students attained grades A1 to C6. In the worst performing year, 2007, only 10.58% made grade A1 to C6. This was followed closely by 12.95% in 2008. Mr. Speaker, what this shows is that if you invest in education, you will see the results. This shows progress. These statistics demonstrate the modest gains that we are making in improving quality of education. But I'll be the first to admit there is more room for improvement. I'll continue to work with all stakeholders to achieve measurable improvements in the results of our students over the next few years. And I call on all parents and opinion leaders to join me to ensure that our students commit much more time than ever before to their studies. Mr. Speaker, our policy at the tertiary education level remains the maintenance of high standard, achieving equity and ensuring relevance within the context of producing high caliber manpower able to fit into the world of work and lead our transformation agenda. In the 2013-2014 academic year, enrollment into universities increased by 7.1%. Enrollment into polytechnics increased by 3.4%. And in colleges of education, enrollment increased by a whopping 63.8%. Work on the main campus of the University of Health and Allied Sciences, located at Sokode Lokwe, near Ho, is almost complete. The university has also admitted its first batch of medical students. And at the University of Energy and Natural Resources, the first batch of agricultural students have been admitted to the Doma campus. Expansion works are continuing at the main campus in Sunyani. And in line with our policy to establish a public university in each region, government has presented to Parliament a bill for the establishment of the University for Environment and Sustainable Development in the Eastern region. Preparatory works for the construction of the university's main campus will commence this year. Mr. Speaker, I've received an interim report on the possible conversion of some campuses of the University of Development Studies into autonomous institutions. Further to that, government will explore the processes towards converting the Wa and Navrongo campuses of the UDS into autonomous universities in the Upper West and Upper East regions. Mr. Speaker, I'm impressed with the progress of work on two historic projects: a new office complex for the Ghana Academy of Arts and Sciences, and a new secretariat for the Association of African Universities. Government is also working towards our vision to improve access to quality education at the tertiary level through the deployment of information and communications technology in distance learning. In this regard, a $37.5 million distance education ICT facility has been established, linking all the 10 regional education centers of the University of Ghana. The facility also includes 3,000 internet-ready tablets for students, video conferencing facilities, and smart lecture theaters. Mr. Speaker, in my address last year, I called for support from honorable members and the academic fraternity for our decision to establish a national research fund. The time is now. A draft bill for the establishment of the fund is currently undergoing stakeholders' consultation and review. We need the cooperation of all stakeholders to operationalize this fund. Mr. Speaker, work on the conversion of polytechnics to technical universities will progress with the expected passage of the Technical Universities Bill in this House this year. Conversion of each polytechnic will be assessed based on equipment, faculty, strong collaboration with industry. The expected takeoff date is September 2016. And in preparation for this conversion, government is going to scale up our interventions in the nation's polytechnics, including a rigorous staff development program to meet our policy objectives. I'm encouraged by the overwhelming endorsement of the conversion by faculty, students, industry, and the alumni of the polytechnics. Mr. Speaker, under the Skills Development Fund of the CODVET, which is developing skills and promoting technical and vocational training, over 150 million Ghana cedis in grants have been provided to 510 grantees made up of institutions, businesses, and associations. Some of the beneficiaries are the Kwame Nkrumah University of Science and Technology Jewelry Design and Technology Center, the Progressive Electronic Technicians Association of Ghana, the Ghana National Association of Garages, the Ghana National Association of Poultry Farmers, and the Ghana Association of Electrical Contractors. All these organizations have benefited. This year, grants totaling 65 million Ghana cedis have been earmarked to be disbursed to an estimated 100 private sector firms. Through these interventions, technical and vocational education graduates are being offered expanded opportunities to translate their knowledge and skills into the creation of more jobs, while at the same time transferring their skills to others. Mr. Speaker, the implementation of these vital programs and projects have been prioritized and adequately budgeted for. Indeed, the 2015 budget allocates the biggest portion to the education sector of about 6.7 billion Ghana cedis. Mr. Speaker, and still talking about budgetary allocations, we will this year spend over 3 billion Ghana cedis on the health sector. This huge allocation confirms our view that a good economy resides in the health of our people. In the last few years, government has pumped billions of Ghana cedis into the provision of modern hospitals and the upgrading of facilities to facilitate speedy healthcare delivery. There are currently several major hospital projects under construction, which when completed will collectively deliver approximately 6,000 new hospital beds to facilitate access to improved healthcare between now and 2017. Mr. Speaker, the hospitals include a 617-bed University of Ghana Teaching Hospital, a 420-bed Ridge Hospital Expansion Project, a 104-bed Police Hospital Project, and this is a beautiful one, a 500-bed military hospital project located in Kumasi. This will be the second military hospital in Ghana. And I asked the soldiers what they will call it, and they said it will still be 37 military hospital, Kumasi. Mr. Speaker, the second phase of the Tamale Teaching Hospital Expansion Project will add another 400 beds to the already existing 400-bed Tamale Teaching Hospital. Mr. Speaker, a 160-bed Upper West Regional Hospital is under construction. A 130-bed Maritime Hospital is under construction in Tema. And a 295-bed Bolgatanga Regional Hospital is ongoing. Mr. Speaker, additionally, work is at various stages of completion on 13 district hospitals to bring health services closer to our people. These include a 120-bed hospital facility at Dodoa, Mr. Speaker, in Fomena, in Kumau, in Abetifi, in Garu Timpani, in Sekendi and Takrady, where the old European hospital is being refurbished. We're also constructing a 60-bed hospital. Mr. Speaker, in Tepa, in Nsoko, in Konongo, in Madina, in Salaga, and Trifopraso. Mr. Speaker, we've also completed and commissioned for use 3 district hospitals in Ejumako, Esam, and Zabzugo, and 19 health centers at the following locations: Amasaman, Dofo, Poku Krom, New Jejeti, Pakro, Gwelu, Funsi, Sang, Bwipe, Manson Kwanta, Abuakwa, Mase Sosekpe, Keji, Adamso, Kayoro, Timonde, Bonsu, Nkwanta, and Dadieso. And Mr. Speaker, this year, we shall commence the construction of another 15 polyclinics, 10 of them in the central region. And these will be located at Besiase, Gomwa Daurampong, at Biriwa, Echi Sunkwa, Esikuma Jamra, the rest are Agona Duakwa, Bimpong Akumfunde, Ekumfi Nakwa, Trifuatimokwa, and Gomwa Potsing. Mr. Speaker, another 5 polyclinics will commence this year in Greater Accra region, and this will be located at Adenta, Ashaman, Botiano, Oduman, and Sege. Mr. Speaker, the provision of modern diagnostic and treatment equipment under the National Medical Equipment Replacement Program has been expanded to cover 150 hospitals across the country. All teaching hospitals, all regional hospitals, 125 district hospitals, 14 health centers, and 8 mobile clinics have benefited from this program. The equipment received by these institutions range from new magnetic resonance imaging equipment, MRIs, computerized tomography equipment, CT scans, fluoroscopy, X-ray, and digital mammography machines, oxygen plants, and ambulances. Under this program, the nation's foremost teaching hospital at Kolebu, that is the Kolebu Teaching Hospital, received significant resources to respectively replace and rehabilitate obsolete equipment and theaters. Mr. Speaker, as a result of this, the pediatric surgery theater, which had remained closed for almost 8 years, the general surgery theater, the neonatal intensive care and babies unit have all been refurbished and are currently operational. Mr. Speaker, the St. Joseph's Hospital in Nkwanta, the Adidome Hospital, and the Dodo Pepesu Hospital and the Jasikan Government Hospital, all in the Volta region, have also benefited from the National Medical Equipment Replacement Program. The outpatient utilization of our National Health Insurance Scheme went up to 27,400,000 subscribers in 2014. This is a sure sign of the benefits of the scheme to many of our citizenry. We will strengthen the fraud detection capacity of the scheme in order to eliminate, detect, and sanction facilities and personnel who take advantage of the system. This week, a portion of outstanding claims is being disbursed to health providers. Government will work to review the scheme to ensure its sustainability. Mr. Speaker, in January this year, the nation's health delivery effort was severely threatened by a fire outbreak at the Central Medical Stores, which resulted in the loss of medicines and equipment estimated at 356 million Ghana cedis. The cause of the fire is currently under investigation. Short-term measures have been put in place to mitigate the impact of the fire, including the ordering of very critical medicines to mitigate any risk of widespread shortages. The Ministry of Health is reviewing the health sector supply chain master plan with a view to improving the system of procurement. This new health commodity supply chain system will undertake procurements through framework contracts and use the economies of scale so derived to drive down the prices of drugs to impact positively on the health commodity security and the sustainability of the NHIS. This improved supply chain will also cover other health facilities, including the central pharmacy of the Kolebu Teaching Hospital. We've made significant progress in reducing the incidence of HIV and AIDS and are on track to achieve virtual elimination of mother-to-child transmission. We're also working with local pharmaceutical companies to expand the domestic supply of antiretroviral drugs. Mr. Speaker, as part of our commitment to the protection of the vulnerable, over 10,000 senior citizens are being provided free NHIS subscriptions in the Greater Accra, Central, and Eastern regions. Our senior citizens in communities such as La, Choko, Akotolante, Madina, Teshi, Ashama, Nima, and Nungwa are benefiting from this package.